Hello everyone, Bright Life Science again, and in this video we're going to talk about the Jones criteria, specifically the 2015 revised Jones criteria for acute rheumatic fever. So the Jones criteria is a diagnostic tool used in the diagnosis of acute rheumatic fever, and it is a combination of parameters from history, physical examination, and investigations. So as we all know, for every patient, we need to do the three. We take history, we examine the patient, and also do some investigations. So for this condition, we're going to get parameters from those three, and we're going to see how this criteria enables us to make a diagnosis. So this criteria has major and minor criteria. But even before doing that, you must have evidence that this person has actually been infected by Group A Streptococcal. And this can be done either through a throat culture, whereby you must have a positive throat culture, or a rapid antigen test. You can do that. Or still, you can prove that there has been an infection by proving that there has been elevated anti-streptolysin or titers, what we're calling the ASO titers, or the anti-NAS B. So the major criteria is composed of the carditis. So the patient should present with carditis, symptoms of carditis. For example, a new onset of mitral or aortic agitation, murmur. Then we have the migratory polyarthritis, as we saw earlier that these patients are going to have the migratory polyarthritis. Then Sydenham Chorea, Erythema Marginatum, and subcutaneous nodules. So those are the parameters in the major criteria: the carditis, migratory polyarthritis, Sydenham Chorea, Erythema Marginatum, and subcutaneous nodules. Then in the minor criteria, we have parameters like fever, a fever of equal or above 38.5 degrees Celsius, that is in the low or moderate risk, or above or equal to 38 degrees Celsius in the high risk. Then you must also have elevated ESR or CRP, also prolonged PR interval, and polyarthralgia. So this criteria has the major and the minor as we've listed them. So how are you going to use these? So after assessing your patient, after taking your history, examination, and doing some investigations, and you find out that this patient has either of these things here, any. So you try to find out which of these the patient has. The patient may not have all, but just need at least two major criteria, all one major plus two minor to make our diagnosis. So to summarize, Jones criteria is a diagnostic tool which we are going to use in the diagnosis of acute rheumatic fever, and we are saying that it has the major and the minor criteria, whereby the major criteria is composed of carditis, migratory polyarthritis, Sydenham Chorea, Erythema Marginatum, and subcutaneous nodules. And the minor criteria, which has fever, elevated ESR or CRP, prolonged PR interval, and polyarthralgia. So, presence of two major criteria is just enough to make a diagnosis, or one major criteria plus two minor criteria. And that is when you have an evidence that this someone or some individual has been infected with Group A Streptococcal. Thank you. Don't forget to like, subscribe, share, comment. And if you have any queries or any questions, put them down in the comment section and shall be worked upon.